Welcome back to Balance Beings Uncut, where we talk about health, wellness, and everything in between. Today I've got one of our naturopaths joining us, Bonnie. Thank you for coming on today.
Thanks for having me.
Today we're going to talk a bit more about recurrent sicknesses, especially with supporting through daycare, and also talking a bit more about supporting through vaccinations to reduce that sickness post-vaccine. Did you want to take me through a bit more about what you found in the clinic with recurrent sicknesses and kind of what you look at to begin with?
So looking at recurrent sicknesses, we'll see having a look if it's an issue or if it's normal. So how often are they getting sick? How long are they taking to fight that sickness? Having a look at the past history. Usually always having a look at that microbiome as well to see if there's any contributing factors into why they're continuously getting sick. Do they have no good bacteria in their gut? Have they got bacteria parasites?
Yep.
That stomach lining, all issues.
Definitely. I noticed that the stomach lining, we always talk about it, but secretory IgA in the stomach, which we see through a microbiome result, secretory IgA is actually the immune system in the stomach. So when people say, 90% of your immune system's in the stomach, what they're actually referring to is secretory IgA. So secretory IgA role is to actually bind to pathogens and parasites and viruses and take them out of the body. So if you don't have that secretory IgA and it's damaged, it's not going to be working efficiently to take out bacteria, which means your child's going to be sick and stay sick longer.
Yeah, absolutely.
So it's so key. What are the types of nutrients and that you use to help with secretory IgA? What are your go-tos?
Saccharomyces boulardii SB is a really good one. Slippery elm, glutamine, bone broth, things like that can be really good.
Cod liver oil for vitamin A and vitamin D will help really well with the stomach lining as well. So doing those types of things like cod liver oil and collagen in your kids' diet, or making some gummies, they really help with helping support that secretory IgA, which is going to help with their immunity long term as well. So that's
and
really
generally there's some dietary changes that need to have a look at while trying to heal it, like repair those secretory IgA levels. So like dairy, gluten are big ones, sugar are big ones that can damage those secretory IgA levels.
Even with sugar alone, it impacts the immune system because your immune cells do not normalize until 6 hours after every sugar intake.
Yeah, like it reduces that white blood cell activity by 50%,
Yeah.
which is really interesting. So if they're continuously having sugar, these white blood cells every time are downgrading by 50%, plus combining all these other factors we spoke about earlier. So no wonder they're getting sick.
Exactly. So if your kid's eating sugar twice a day, then essentially their immune system's working at 50% reduction to support them and getting them better quicker. So it's so important to making sure that you're normalizing that. The other thing that I wanted to bring up is nutrient deficiency. So the most common that I see that cause recurrent sickness in children is iron and zinc. They're the most common ones. Sometimes magnesium as well, but iron and zinc, they're directly correlated to sickness in children and recurrency as well.
Yeah, immune system function.
So again, we look at those nutrients in a hair test. A hair test will show us your kids' iron and zinc levels. They can also get tested in a blood test. And so these are really important to be seen because we want to make sure that they're having those. But again, coming back to zinc and iron, it comes back to absorption. Both of those get absorbed in the intestine. And so if our cells are not working effectively, they're damaged, there's zonular secretory IgA, and we've got the leaky gut picture, again, they're not going to absorb those nutrients.
I think like we're continuously looking at why. So it's good we get answers there. Iron deficient, zinc deficient. Let's dive deeper. Why are they iron deficient, zinc deficient? It's usually something in the gut, like you mentioned, but also parasites, we know, are a big one for iron deficiency by feeding off that iron.
Yep. So a lot of times parents comment about, I want to give my kid iron, they're deficient. But what we have to explain is the actual process of that. So harmful bacterial overgrowth and particularly parasites, more widely studied, they actually feed off iron. So what that means is if we give a child an iron supplementation during that time, what will happen is the iron won't absorb in the body because the parasite will be actually eating and feeding off that because it's inflammatory. It helps it to survive. So we actually want to be making sure we're killing off any harmful bacteria or parasites and repairing the stomach lining before we even start iron supplementation or zinc supplementation.
Yeah, absolutely. Sometimes it's still going to be indicated, but at least if they're having dietary forms of zinc and iron, by eliminating that parasite, they're going to uptake it a little bit more, and it gives us an understanding of what sort of supplements we need where.
Even when I have clients that come in with cost restraints and they don't have the fees to order a microbiome test, and they've been seeing doctors before with iron or zinc deficiency, these children, and we've got that kind of barrier of healing, what I still do is I still repair that stomach lining before I give them iron supplementation, because I know that if they've tried to replace those nutrients before without success, then it means that it's the absorption. So even if I'm not killing parasites and bacteria because I can't test to see if they're there, then at the bare minimum I use is some SB to do any clearance that I can safely without knowing what's in there, and repairing that stomach lining with glutamine, cyprium, cod liver oil as well before I even go in with iron supplementation or zinc for children and adults. So if you've got a long-term iron deficiency, or your child does, it's a really big indicator that you're not absorbing it, and you need to look at your gut microbiome as well.
Definitely, there's something else going on there.
Definitely. What are your go-to herbs to help with the immune system straight away if someone's just getting sick recurrently and you want to get them better?
Echinacea is a really good immune one. It's pretty standard. It's immunostimulating, but it's more so immunomodulating. So if you're having an overactive immune system reacting to things and antigens, it's going to downregulate and kind of modulate that. Thyme's a really good one for upper respiratory tract infection. What else would I be using? Like, depends what's going on. Eyebright,
Yeah,
pelargonium.
I love eyebright and pelargonium. They're my go-tos as well. Elecampane as well is also super helpful. Andrographis can be used a little bit, and licorice, but andrographis isn't as common.
Yeah, I find that can be a tricky one. Like, it's if you're in an active acute stage of sickness, it can actually be worse. Type 1, so it's better to be being on something like after you've had that acute sickness.
Definitely.
But I still find it's very effective.
And I find that a lot of people, like, you might give them andrographis, but then if they get sick, it can be a problem too. So I don't use that one as commonly as the other ones that have got better support there, study-wise. The other thing I wanted to mention is going back to stomach lining a bit more, and underlying conditions for children that are coming in with recurrent sickness, celiac disease. So if a child has celiac disease, then a lot of times that can cause them to be sick recurrently as well, and they're never going to get better and seal that stomach lining up and to repair it, because they're having that gluten intake, which is actually causing damage constantly.
Yeah, and I find it's kind of under flagged with GPs type things in terms of looking at recurrent sicknesses. Like, sometimes I've found in clinic that the kid is often sick continuously. There's been no investigations into celiac. We start having a look at it too, and it's like, yes, they do have it, and it's been so hard. These kids live with that for such a long time.
100%. And I also find that a lot of times, parents have to push for the celiac testing as well. And then a lot of parents, a lot of children aren't getting a dose high enough each day for it to actually be a proper reading as well. So it's also something that I find is super common cause. The other thing that I would mention as well is, again, high copper levels impacting zinc. So a lot of times I'll see kids with high copper and they're sick all the time. That's because, again, like Bonnie mentioned in our previous podcast, that it's like a key. The zinc's not being able to be used in the body for the immune system because the copper is blocking that absorption side as well. So really important factor to be looking at in regards to heavy metals. A lot of heavy metals can impact our absorption of nutrients and impact recurrent sicknesses just by increasing oxidative stress and inflammation in the body.
Inflammation. If our body's continuously inflamed, then it's always having this low grade, it's fighting off something, and the body's working extra hard than what it needs to do. So when something external and like an antigen, a sickness comes, the body just completely falls apart, doesn't know how to heal it, because it's always got that low level trying to heal itself and fix it up.
So if we have someone coming in with acute sicknesses, and they want support straight away, I would be thinking of like echinacea and eyebright and pelargonium, and like vitamin C and zinc and maybe some NAC. But if we're thinking more long term, we want to run some investigations like checking they don't have celiac, doing a gut microbiome test. If they're all normal, because that's our first point of call, because there's more likely to be stuff come back in the microbiome than a heavy metal test for sickness for kids. Then we'd run a hair test to see zinc and copper levels and iron.
Yeah, like even looking at those hair tests, we look at like subclinical. I often see the selenium's really low as well. And that's a key component, or not really low, subclinically low, for detoxification and immune support. So I think having a look at that is really good.
And it also supports with oxidative stress too, which can be really helpful. I find that a lot of parents will think that how often their kids is getting sick is normal. So what's actually recommended as normal is if your kid's getting sick more than every 10 weeks to 15 weeks, then it's abnormal. So obviously, if a kid is getting sick more than 10 weeks, I'm getting worried. because then that means that their body, there's something more internal going on that we need to investigate. But again, obviously, if they've never been exposed to much much viruses and pathogens, and they're going to daycare, and their immune system isn't as robust, that is going to be a causative factor too. That's why you want to give them some support prior to.
Yeah, absolutely. It's yeah, we're both parents. We've been through that daycare sickness, and when it kind of first hits you, like you've never been exposed to many bugs in your life, which is somewhat normal, but it's how often they're, how long they take to get sick, and how often. So I'm really more like pro preventative daycare sickness and doing the things first, like you mentioned, preparing that body, preparing them to be exposed to those antigens because we know it's coming.
Yeah. Get on some glutamine and some zinc and vitamin C on the bare minimum to support the gut lining and nutrients that could be low, and get a little acute herbal made up, starting that at least 6 weeks before the child starts daycare to make sure that their immune system's fully ready and functioning at optimal, ready for pathogens to reduce the risk of them getting sick and staying sick.
Yeah.
Also, some SB goes a long way when we start
removing sugar,
as well.
like we mentioned earlier.
Removing sugar, big trigger, because then the immune system can actually work properly every single day instead of being at a 50% reduction rate as well. What about mold? Would you say is a trigger for kids' immune systems?
Absolutely. Mold is a massive trigger for like recurrent infections, sinus infections, allergies, itchiness. It also impacts our microbiome composition. So if we haven't got good bacteria, then that's pro-inflammatory. Those secretory IgA levels are coming down low. So we're having that immune system response just on those low grade levels there. So it's a big, big key issue.
Yes. And I find that removing people from the area is key first, because you cannot clear mold in the body if you're getting that re-exposure as well. So looking into that, and just because mold isn't, you can't see the mold, doesn't mean there's no mold in the house.
Yeah.
As well, I think is key. And the other thing that I wanted to mention is we can look at some markers in a microbiome test that shows mold exposure as well.
Yeah.
So we can see that in there, or we can do some privately further testing for mold to actually identify like a comprehensive mold test as well. But oats test or a microbiome test can show us some factors, and if we've got the presenting complaints there with it, and we've got those little symptoms in our test, then we'll treat as mold.
Yeah. I think this is especially important for, like, we know when they're going to daycare and they're going to be exposed to many like sick children, etc. But if you've got your children's not at kindy or daycare, or they might be going to a home daycare with a small amount of children, they're still very, very sick. It's important to have a look at that environmental things, like is there mold in the house?
Yeah, and looking at identification routes can be looking at the timeline of events. So if your child's getting sick all of a sudden quite frequently, or they're always getting sick after being at a parent's house or grandparent's house, that's a sign that they have mold in their house as well.
So it depends, like we all have a certain tolerance. Like some people are more like allergic to it, some people can tolerate it, some people don't. So you might find that if it's that they're going over to their grandparents' house or someone's house and they're coming back sick or itchy eyes, sneezing, then I would be safe to assume that they're very sensitive to the molds, which is going to have a bigger impact. Whereas other people, they're not as sensitive to it, so they don't have that acute kind of reaction. And
we need when we support mold exposure, the first thing we do is we regulate mast cells, which is regulating the immune system and supporting the immune system. So that similar things, Bakel skullcap, vitamin C and zinc really, really help. Vitamin B6 can be really helpful too for mast cell regulation. And so that's the first key factor that we do for mold.
Making sure our bowels are moving properly.
Detoxification pathway, step 2. Clearing out any bacterial parasites or candida that's present that's worsening that mold exposure as well. And then we go in with binders for the mold. But there's no point in doing that if we're not removed from the source as well.
Absolutely, because it's just continuously circulating. If we're not doing those first steps first, and we're just going in with like binders, even say for heavy metals, the body is detoxing, it's got nowhere to go, then we're going to have a worsening of symptoms. So it's important to take it slow, even though you probably just want to get in there straight away, fix it, eliminate it. It's not the pathway that we need to take.
Definitely. And I find that, when we look at our microbiome tests, low secretory IgA and candida can be the first kind of symptoms that I see for mold exposure as well.
Those low levels of bacteria, even I believe Oxalobacter is impacted by mold.
As well. Definitely a big trigger. And then the other thing that I wanted to come on and mention is again, dietary factors like removing high copper so that zinc can actually be absorbed from our foods. So again, like a water filter could be really, really helpful. And then the other thing is what to do post antibiotics if your kid does need them. So if we think about antibiotics, it does strip that good bacteria in the stomach. So we need to make sure we go and replenish. Sometimes it can allow other types of bad bacteria to actually flourish and grow because it strips the good bacteria. And if there's a bad bacteria that's antibiotic resistant, like Klebsiella can cause it to grow stronger, which can cause a lot of issues in children.
Yeah, even opportunistic bacteria. So we know it's bacteria that we all have present in our gut, but having those antibiotics gives it a favourable environment to grow and flourish and can still cause many problems.
Yeah. So making sure you're going on to good quality like lactobacillus and bifidobacterium with Saccharomyces kind of probiotic after antibiotic support if your child does need it, and looking at giving them an extra bit of stomach lining support. Because a lot of times antibiotics can cause that damaged stomach lining as well.
Yeah.
When we think about if we think about recurrent sicknesses for children as well, a big thing that I see is recurrent ear infections. So again, recurrent ear infection or respiratory infections can be a mold trigger, so that's something we look at. It can be cross transfer of like streptococcus or other types of bacteria like staph that goes in the ear through the respiratory system from our mouth, because our mouth passes a lot of bacteria through the respiratory system. So that can cause recurrent sicknesses as well. So making sure that you're actually doing a microbiome test is key. So we can actually look at that bacteria that's there. Then we know where to treat and how to treat. Like if we have strep or fusobacterium in the stomach, we know it's going to be in the mouth because that's where it can originate.
Yeah.
So we want to make sure we're doing a protocol to clear that out too, which means that's going to help with that respiratory system. So that's so key as well, killing off that bacteria, looking at the bacteria so you know what to kill. Like if we have streptococcus, we want to use echinacea and whatnot. So it gives us specific types of herbs we need to use and how long to do duration for as well when it's occurring.
Depending on those levels that we see. And I feel like this is a really big one for ear infections because ears are quite sensitive. We don't want to have hearing loss. So I find that parents are usually coming in and their kids had recurrent ear infections. That goes hand in hand with the recurrent antibiotic use. Whereas more these like colds and flu type ones or even gastrobugs are not choosing to use antibiotics as much. So looking at ear infections, they've usually had a big history of antibiotic use. So there is always gut work that we need to be doing.
So ear infections, first point of reference is always doing gut lining work and gut bacteria because, again, a lot of times that can be in the ear from the mouth and the stomach because it can, essentially propagate in all different areas in the body that's got microbiome. The other thing that I think about is mold, and then the other thing for ear infections we think about is intolerances. So I've had clients before that we've cleared their ear infections with no recurrence, and all it was an intolerance of almonds and gluten as well. Again, we want to look at the microbiome first because a lot of times intolerances occur because of the stomach lining or different types of bacteria that's causing intolerance, like histamine release from Klebsiella. So looking at that first is always key, but once we've done all that work, if we're still getting ear infections, we want to look at secondary factors like long-term intolerances that aren't caused by the gut microbiome as well. So that's definitely things that I look at. But tip-wise for diets with getting sick recurrently, if they're not seeing a naturopath, what would you give them some recommendations to do at home?
If they're getting sick recurrently, I would be, number one, eliminating sugar, any other potential inflammatory mucus-producing foods like gluten and dairy. I would be trying to incorporate more bone broths into their food, just working on healing and sealing that gut lining. Making sure they're having enough water consumption, making sure we are looking after that microbiome, so brushing their teeth and keeping up with that oral hygiene as well. I feel like this can get missed in children a little bit and they're coming through, and especially if they've got poor oral hygiene as well, that's something to looking more into the gut. It's not a normal thing to see in children.
Yes. The oral hygiene is definitely a key one because a lot of people don't brush for 2 minutes and clear that all out, or they'll let their kids eat after they're brushing their teeth and whatnot as well, which is allowing those pathogens to grow, which then it transfers to other areas in the respiratory system because it's all interconnected, the ears and the nose and the mouth. So that respiratory system is going to really struggle if we've got that in our mouth. The other thing that I find that's really, really helpful is making sure you're not giving your kids lots of iron-rich foods at the time when they're sick, because the iron will actually can feed parasites and make things worse when you're sick.
Yeah,
So making sure,
pro-inflammatory.
yeah, you're not using any iron or giving them any beef liver or anything like that when they are sick, because you're going to make the problem worse. Look at camu powder, really, really good for immune system because it's so high. I'm having a mind blank. I'm pretty sure it's high in vitamin C. Camu powder, and then zinc, pepitas, seafood, making sure they're having lots of that when they're sick or getting sick recurrently, and then looking at the collagen, the gummies, so we're making sure we can actually absorb these good quality nutrients we want in their diet as well. And then if you've done all that and your sick child is still getting sick recurrently, that means there's something internal going on that we need to look at, looking at that gut microbiome and whatnot as well.
Other things like nice antimicrobial type rich foods, so like garlic is quite good.
Herbs
Lemon and ginger
spices.
teas, herbs and
Turmeric
spices,
as well, 100%. And a lot of times we'll see kids getting sick recurrently after vaccinations. Vaccinations are exposures of small doses of types of disease.
Yeah.
So that it's going to impact their immune system. So you want to making sure that you're doing some prep and support, especially if your kid has been getting sick around the time of their last vaccination as well. It's a sign that their body's struggling with that. There's a few different reasons why. What is your go-to factors to think about and things that you use for vaccination support?
So I'd be looking at doing similar to that immune system support that we were saying earlier, cleaning up their diet, making sure that they're doing this well, looking at some cod liver oil in their diet, in their regime, I should say. Other factors like a compound might be quite good with some NAC in it.
Yeah, 100%. So I think that supporting detoxification pathways, supporting brain support, and to make sure that there's no any other effects from all the oxidative stress that it causes, making sure we're doing enough detoxification to support any heavy metals that we get exposed to, and then making sure we're supporting that gut lining, repairing and supporting that good bacteria levels, because it can strip that a little bit, and then making sure that we're supporting the immune system doesn't go into hyperactivity.
Yeah, so especially making sure that we're not doing any vaccinations if they've been sick. We want them to be well for a certain period of time before they're going in with the vaccinations, because that can just be an immune system overload and they can get quite sick from it afterwards. So making sure that they're healthy beforehand and not like, oh, they were sick last week, now we're going to do it. It needs to be a decent amount of time. Then once they're well, we can go into that prep. So 10 days pre-vaccination, we can look at doing all those supporting factors as well.
Definitely. And I think that also how long your kid hasn't been sick for, I don't want to see any runny nose or anything for at least 2 to 3 weeks before you're even doing a vaccination.
Yeah.
And making sure that if it's multiple at once, we're spreading it out a minimum 6 weeks. So the body actually has time to get over that pathogen, and the immune system's normalized before we then are going to go do it again. And then, some things that we think about is we obviously want to have support heavy metal binding, because there's some heavy metals in the vaccines. But what we want to do is we want to do that last. We want to actually support detoxification pathways through things like turmeric and dandelion root and some St. Mary's thistle, and using things like echinacea and eyebright and pelargonium to support the immune system prior and post. Diet-wise, sugar, making sure they're moving and active so they're detoxifying properly.
Yeah, jumping on trampolines really good.
Doing some gut lining support like glutamine and cyprium to support that stomach lining prior to vaccination as well, so that it's protected. And then I love to use bacopa or ginkgo biloba or turmeric, because that supports that brain support around that time as well.
Yeah, the other thing I think is important too, if the parent's quite concerned or that highly sensitive, is having a look at the MTHFR, because they know they're not going to be able to detoxify as efficiently as others. So that's something it's good to know. So then we can give them the support that they need. So there's some times where if they do have that gene variant, they need that extra support rather than just supporting detoxification pathways. And in general, we go in with more specific support to just minimize any.
Definitely. I think that's really good point of call, and good to remember that heavy metals are harder to remove and clear and detoxify naturally from the body, and oftentimes it won't occur if your child has MTHFR. That's why it's good to know, because we know we need to do a longer detoxification
Absolutely.
route and pathway to clear that out. Especially remembering, because a lot of kids can have different types of SNPs of MTHFR and multiple, which means impacts their methylation and detoxification pathway even more. So that's definitely the tips that I would give. Again, nuts and seeds diet-wise as well for that zinc level support.
Essential fatty acids are really good.
Yeah, and making sure if your kid's getting recurrently sick and you've done all these dietaries, making sure you're going and looking at booking in with someone who's going to actually identify the causative factor as well. Even have kids that come in with ear infections recurrently, even after they've put in grommets as well, and that is then showing us, hey, it's bacteria most likely causing this reoccurrence to occur. So
it's very common. You'll see that the grommets will go in and then they're still having these sicknesses that we have. But then on the other plus side of that is that I've been treated like patients, and even my own two boys have had ear infection problems, and when we can get to the root cause of it naturopathically, that eliminates the need to even have the grommets in the first place. So reducing their like toll on the body, I guess you could say, by working on those underlying factors, whereas sometimes we don't know what we don't know, and it's only until the grommets go in that it keeps happening, and then they start to look into it deeper. But it's really important that if we're aware of it and we're kind of more open to natural treatments, to doing that route first rather than just going straight into the grommets. You can avoid the
surgery.
Absolutely.
Especially because sometimes we'll find that it doesn't even help after and they've already done that surgery. And it's really important, because I find that, if you've had ear infections, your child has had ear infections more than 3 times, that's a sign that there's an internal factor causing it. That 3rd time really shows us that, hey, something's causing this, which isn't normal. So again, for Indiana, she was having recurrent ear infections when she was 2. We were able to avoid grommets because I found that she had Klebsiella in her stomach lining damage, and she was iron deficient. So we worked on all those factors, and with that 6-month period of doing that, she never has had an ear infection since.
It's kind of similar to my boys. My youngest child, he had the worst ear infections ever, and then when we did that testing, we had a look at underneath what was going on. He's been fine ever since. So it's not, it's a common thing, but it's not a normal thing. I think it's common for children to get a lot of recurrent ear infections, etc., but it's not normal.
And remembering that you may have tried a microbiome and then your kid's still getting ear infections, then we need to look at intolerance testing, we need to look at mold testing, because there's a reason why it's still occurring. We can't always tell which one it is straight away, unless we have those clear timelines of events, which does help a lot.
And we're continuously looking at that further questioning and that further undercovering. So say, for example, we're having a look at the heavy metals and they've got heavy metals there. Why do they have these heavy metals? Why? Continuously asking why, and that's how we get to the root cause of actually what's going on. So even if we get answers from the microbiome and find these bacteria, like you said, continuously looking at why.
Yes. And I even had a client that's child was wearing lots of silver, and had really high silver levels in their results. And I found that that was the cause of the recurrent sicknesses in children in that child as well. So it can be something as simple as environmental a lot of times as well. So it's something to look at too.
So looking at modulating their diet, so having warm foods,
nourishing foods,
herbal teas, soups, broths.
Well broken down foods, because they're not going to be absorbing as much at that time, because their stomach and the secretory IJ is trying to clear the bacteria.
And I think that's another important thing as well, is that often when we see our children sick, it can be really heartbreaking. They're not their normal selves, and it can be really easy to reach for the Panadol or Nurofen to get them feeling back to themselves. But this healing stage and the reason why their body is slowing down is really important. It's really important for them to go through that process so their body can figure out how to fight this off on its own and can figure it out, and that makes the immune system stronger and more durable, so that if they're having it again, they're able to recover quicker.
So the more times your child's having antibiotics, the more it's going to cause that reoccurrence to occur as well, and more dependency, because their immune system's doesn't know how to build back from that sickness they got, and then the antibiotics stripping all that good bacteria and secretory IJ and stomach lining, which is allowing a scarier bug for their bodies not to be able to essentially come towards and be able to kill off themselves and clear out. So it's kind of counterproductive, because back 50 years ago there was no antibiotics. was it 50 years ago? It would have been about.
Yeah.
So what would happen is your kid would get sick, but then they would get over it. And then if they got something bigger and stronger that would make them more sick, their immune system had grown from what the last infection was.
Yeah.
So they could actually grow each time the immune system was getting better, not more depleted and then something else comes up because they're more prone to it because they don't have anything to take it out, like the secretory IgA.
Yeah.
And even with fevers, there's a purpose of having a fever as well.
Yeah.
And people forget that. And I go straight to Nurofen and Panadol. And don't get me wrong, if we're getting over that 39.5, then we are high risk of febrile seizures and convulsions. So it is indicated, or go to hospital. But if we're under that point reference, then it can actually be productive because a fever is helping to clear out a pathogen and bacteria. It's the immune system's ability to clear out what it needs to clear out. So it has a purpose, and it's actually going to get your kid better quicker and get their immune system stronger by not reaching to those Panadols and Nurofens during those times if you can avoid it.
Yeah, so it's like like you said, the fever has a place, convalescence, which is our rest period, that's got a place in time. So really just supporting their body's natural processes, not fighting it off and trying to get them back to normal quicker.
And remembering if your kids are sick and unwell, doing less is key. Don't go take them to swimming lessons. Don't go take them to gymnastics if they're sick. Their body needs rest. It needs time to recover. It needs time to relax so that the body and the immune system can actually do what it needs to do, which it can't do when it's running around the whole time.
Yeah, and what a beautiful lesson that we're teaching our children from a young age, that to take time for themselves and to rest and to slow down, and that the rest of the world doesn't really matter. Like, our health is most important, because how many of us as adults are just like soldiering on, going through the sickness, like pushing through that. So it's teaching our children early on to listen to their body and tune into it for the best.
Yeah, which teaches them and educates them more as they get older too. And it's a good reminder for you, like if your child's sick, oh, maybe I should stay home and support that instead of going out and doing all the things that we do as mums.
Yeah.
That feel super important in the moment. But
in the moment, it's really important, but more so that like long-term health wise for our children. And if we're thinking about it from the perspective as well, if we rush them to feel better soon, then we know there's a high chance that they're going to be more sick more often, and then it leads into a bigger picture thing. So taking that small amount of time, and hopefully they'll be better sooner, quicker, and get back on your feet.
Support them in smaller areas will reduce them getting sick with bigger problems.
Yes.
It's essentially the key takeaway with this as well. And
Yeah.
making sure you're doing what you can environmentally and dietary to support them, like we've discussed on the podcast.
Yeah.
Yeah, awesome. Well, thank you so much for joining me today.
Thanks for having me.
And yeah, if you're finding that your kid is getting sick recurrently and you've tried everything that we've mentioned, then it's a sign to look internally and do some testing.
Yeah.
Thanks for joining us on this week's podcast. May your days be healthy and your weeks be balanced.